Good morning. Welcome to the Community Voice. I can't believe it's another Monday, but we're here again. All you have to remember, it's going to be a good week if there's not a hurricane. And I don't believe there's one on the way. So it's going to be a good week. And I'm Steve Graddick, your host. Delighted to be here. Our Community Voice brought to you by Tanner Health System. And we'll be on Facebook Live this morning, News Talk 1330 Facebook page. You can also call us 678-601 Talk, 678-601-8255. And we're honored to have in studio the new executive director of the Rafah Clinic, Dr. Joseph Cox. And let me give a very brief little bio here of Dr. Cox, and then we'll jump right into it. Dr. Cox earned his Bachelor of Arts in Cross-Cultural Communication from Southeastern University in Lakeland, Florida, and his Master of Science in Education at Nova Southwestern University in South Florida. Then he received his Doctorate of Ministry is what is now Global University. Prior to joining Rapha, Dr. Cox served at NAYF, a substance abuse and mental health center in Central Florida, where he served as both CEO and CFO while operating its business and incubator programs. He's been actively involved in nonprofits for more than 30 years, and he's worked in many mission outreaches around the world, helping to grow leaders and facilitate community development. So, if I may be so bold, on behalf of the community, welcome, Dr. Cox.
Thank you. It's a pleasure to be here.
So you're from Florida, and now you get up and it's really cold outside. So do you have regrets already?
Well, I'm beginning to think so this morning.
I know I do. I'd move to Florida this morning if I could, but anyway, I'm not going anywhere. Well, welcome and to West Georgia. We trust that your stay here will be long, prosperous, profitable, and certainly a blessing to all associated with Rafah Clinic. For those who don't know, and there's always somebody that hasn't been paying attention, tell us about the Rafah Clinic, its mission, and a little bit about the underlying foundational principles of it.
Certainly. Rafah Clinic of West Georgia is simply put a place of healing. It's neighbors helping neighbors. Our mission is to deliver high-quality medical and dental treatment with a caring spirit to the uninsured, empowering self-respect, autonomy, and self-responsibility for making positive changes through Christ. We're a faith-based organization, and the word Rapha actually means healing in Hebrew. It has a wholeness aspect similar to the word shalom in Hebrew. So we're just there trying to help neighbors in the community be served with medical and dental services.
And basically, you mentioned it's the uninsured. And unfortunately, regardless of what's happened with healthcare over the last decade or more, there's still a lot of people who are uninsured.
They are. We serve 5 counties in West Georgia, from Carroll County, Heard County, Douglas, Haralson, and Paulding County. And we estimate there's about 65,000 individuals who meet the qualifications for the clinic.
We're going to come back to more of that in detail, but significant changes going on in Rapha with the Temple Clinic, the Temple location. I want to take some time because that's pretty exciting what y'all have accomplished in recent weeks, recent months.
Yes, you never know when you get a phone call whether it's going to be a positive or a negative change. It ends up being a real positive change for us. Our medical clinic was a modular unit that Tanner Health has supplied through the years, and we developed some mold issues that required us to shut the building down. So to make the long story short, or a short story longer, we move into a new 3,100 square foot medical modular unit that has just recently been pulled to the location, and the celebration for the grand opening will be December 2nd. So it gives us the infrastructure we need to serve more individuals.
I assume the 3,100 square feet is larger than the one that was there?
Yes, about 50% larger.
That's great.
We have there'll be 2 buildings that are backed up to each other. The back building will be 4 dental suites to be able to serve the dental needs of the area.
Now, where is this located, if people don't know?
It's 253 Highway 78 East in Temple, Georgia.
Okay.
right on 78.
Right on 78. Just, I guess, east of Bremen and west of Temple, somewhere there.
Yes, actually, it's on the way from Temple going to Villarica, I believe.
Okay, just east of Temple then. Okay,
Yes.
got it. Okay. And it's not too far out of Temple, if I remember
No,
correctly. Yeah, so, okay, that kind of
no.
gives you not too far beyond the high school.
Correct. About half
Okay.
a mile on the right.
Okay, there we go. Now we got between you and me, we'll figure out where the thing is. But that's great, 3,100 square feet. Um, let's let's take a break and come back because we want to talk more in detail about how we got to this point with this new facility and all the different facilities, how they're staffed, the services provided, et cetera, et cetera. Okay, we'll take a break. We'll be back with more after this from Tanner Health System.
At Tanner, we're advancing health throughout West Georgia and East Alabama because we know that exceptional care isn't based on how many patients we serve, but how well we serve them. That's why we're focused on quality, delivering the best possible care for our patients. It's why we're expanding our clinical services and building new facilities to serve our growing community. And it's why we're looking beyond our hospitals and medical practices to develop sustainable wellness and preventive health programs in our region. What makes a hospital great has changed. It's not how many beds we have. It's how well we care for the neighbors who need them. Delivering the right care to every patient, every time, is how Tanner is advancing health with medicine beyond measure. Learn more at tanner.org or find a physician on our medical staff by calling 770-214-CARE.
Good morning. I'm Steve Gredick. Welcome back to the Community Voice. And I could use a little bit of fire in the studio right now. It's a little bit chilly. We have Dr. Joseph Cox, newly relocated to Carroll County, and newly named Executive Director of the Rafah Clinic, which serves 5 counties, right? You mentioned Douglas, Harrelson, Heard, Paulding, and Carroll. So pretty large service area. And before we jump back into more detail, serving a 5 county area is no small feat. And sometimes when we say we serve a large area, one county tends to dominate, but it seems like with Rafa, you really do serve the whole region, correct?
We do.
Um,
Patients from all 5.
yeah. Tell us, I want to, we can talk about buildings and modular trailers and all the facilities, and we will, but ultimately, Rafa is about serving people
Yes.
and ministering to people. In order to do that, you have to have a staff. It's not just executive director and nobody else. Tell us a little something about the staff, and also I want to talk to you about the dentist and the volunteers and the hygienist and all those that volunteer.
Sure. It's pretty much amazing to see I call them county champions who will work all day long in their own clinic and then volunteer in the evenings or on the weekends at the Rafah Clinic. So we could not do what we're doing without those professional volunteers that have served us from day one in February of 2010 on. So we have a staff that provides a little bit of stability and confidentiality in regards to healthcare. We have 7 part-time individuals who oversee everything from prescription assistant plans to medical coordinators to dental coordinators to administrative help, front office people in regards to scheduling the clients as they come through the door. Because we serve the uninsured populations, we do financial screening to verify where they're at. We do that because a lot of the pharmacy programs where we get free medications for them require that of us. But we've been doing this since 2010, and we work with individuals that are at 200% or below poverty level. So what that works out to be for an individual, it's a little over $2,000 a month or lower.
And you mentioned the prescriptions. The drug companies are seemingly pretty generous when it comes to prescriptions for the uninsured.
They have been. A kind of an untold story in the area is the fact that we do deal a lot with chronic care. And so pharmacies have donated over $1 million this past 12-month period to the clinic that we distribute to the actual patients. It's no feat trying to coordinate that and to distribute it to the neighborhoods.
And you kind of referenced the paperwork. I imagine the bureaucracy, the paperwork, the legal concerns, besides the privacy concerns, HIPAA and everything else. It's really this is really a huge undertaking people probably don't really think about.
It is. We did about 2,000 clinic visits last year, and just the sheer volume of numbers. The government passed the act to lower the amount of paperwork, but what it seemed to have done is increase our paperwork in the clinic setting.
And when we say paperwork, or how are y'all doing in terms of computerization and data management and all of that?
Yes, we do. Probably 60% of our business is with electronic health record system that was donated through Greenway Health.
Yeah, that's kind of what I was hitting at.
Yes, and so it's been a challenge. One of the long-term issues with the Temple site has been the instability of internet and phone systems. So as we're developing the new system, we're trying to work on long-term systems that have been a problem, and we have received funding to be able to do that. We think that'll be revolutionized because you never know whether we're going to have to be paper or electronic on any given day, depending on the storms.
We mentioned the physicians and the dentists and the hygienists and the nurses and all of those, and you reference it all day in the clinic, and then they'll come to Rapha. How does the volunteer system among those professionals, medical professionals and dental professionals, how does that work?
In the community, we have a number of people who have donated their time. Typically, we do a process through the Georgia Volunteer Health Program where they fill out application, and I think it used to be called the Good Samaritan Act for those that provide services that there's not a payment for their services. There is a little bit of sovereign immunity in regards to their insurance and their liability concerns. So basically, it's them contacting the center, us finding a place for them, finding a population that we can use them, especially if they're in a subspecialty, and trying to find the patients in order to fill that schedule up. And then it's just a scheduling process from there.
Do we take these professionals, I guess, anywhere from the 5-county area?
Correct.
Correct. Okay.
Yes, we have some that are actually in Metro Atlanta that actually
come out.
They transport out.
Has it been hard, difficult, easy to get these professionals to volunteer?
It has been a very consistent, stable environment for our professional medical volunteers. We could always use more because more individuals mean more people served.
Well, more and more we got more and more Tanner docs, and I assume a whole lot of dentists, pain-free dentists, of course. That's the only kind we want, right?
Absolutely.
Okay,
Absolutely.
yeah. Tell us. Let's focus a little bit on the need. What is the need right now? Do we have a backlog? Are we keeping up? How many people are needing the services of Rapha?
On the medical side, we've kind of caught up over the past year where we could probably get a new patient into the center probably within a 2 to 4 week period. On the dental side, we are, because of the change to location, we have not had the dental lab or the dental part of the business up and running. So we're about a year behind on dental services right now. We're trying to catch up once we get reinstalled in the new location and move forward. But probably 60 to 70% of our calls are related to dental services right now.
And I'm going to want to come back to that shortly. And we've talked about Temple so much, so let's not forget we've got a clinic in Bowden.
That's correct.
Tell us about it, where it's located, and maybe a little bit more.
Yes, it's at 345 Bar Industrial Road in Bowden. It's near the main thoroughfare downtown, and we've been there since 2012. We offer lab and provider days there about 3 times a month currently, and we just serve the community any way we can there.
What kind of technology? And I want to talk some about the grants, but recently y'all been receiving, and thankfully so, some grants, I believe, from Carroll EMC, Power of the Purse. Tell us a little something both about those grants and to what medical equipment, supplies, et cetera, that they were allocated.
Yes, we're very grant-based at both clinics, trying to serve the neighborhood. The Carroll EMC grant was to provide a new EKG machine for us, as well as otoscopes and stethoscopes in regards to the new facility. So we're about to unveil those at the new location. We also do a lot of technology upgrades in regards to scanners and copy machines in regards to the medical files that are so dependent upon those technologies. We also have a Pentarex X-ray machine on the dental side through the Atlanta Dental Association. And the Power of the Purse grant was related to women initiatives and trying to help individuals that did not have access to GYN care.
I think you mentioned the term innovation grant. Do these come under that category?
Innovation Grant was a new category for the Community Foundation of West Georgia. We collaborated with another agency in town called Waypoint Ranch, and the goal there is to develop a green care space at both facilities and eventually to grow food, healthy food, less traveled food for our patients, those with diabetes and obesity. During interview processes of our 360 analysis, showed a lack of food access for many of our patient population, as well as USDA calls us a food desert. So we're trying to grow some food here locally to support the patients in our program and to help lower their A1C levels.
The USDA calls us a food desert.
Yes.
Are you serious?
Yeah, not a food dessert, but a food desert. Food desert, it just says a region that is very difficult for individuals without transportation to be able to get the nutrient food that is necessary. You know, it's so easy to drive through the drive-through.
Yeah, what's wrong with that?
It's very harder to find that. The health disparities in the area are vast. And with diabetes and morbid obesity being very high in the region, we really want to try to conquer, really, no pun intended, a giant
Right.
in the health disparity area for the counties that we serve.
So this innovation grant from Community Foundation West Georgia in conjunction with Waypoint Ranch, which is kind of in the north part of the county, I think up near Bremen.
Yes.
Which is also a nonprofit, uses holistic alternative therapies and working with veterans and their families, is basically to help provide that kind of food access and to water the desert, if you will.
Yes, it's a grant that's up to 3 years, and eventually we'll be able to have the facilities here to be able to grow a ton of food a year.
You know, we obviously Georgia, the great state of Georgia, is known for having a population that's somewhat overweight and diabetic, et cetera, et cetera. That's got to be when you go into these clinics and the Rafah clinics and you see people that come in great need, but you also see they're carrying a lot of weight around with them. What do you think when you see that? It's like, does it make you cringe or?
Well, it's a challenge. Without moving, we tend to get larger. I know that's true for me as well. The statistics are 1 in 3 are in the morbid obesity category in West Georgia in these 5 counties. In the 18 and under range, it's 2 and 5. So when you're carrying around extra weight, I used to carry books around at the university. It always created sore backs and everything else. So you can imagine carrying extra weight, the limitations that happens over time, and the assault to the different systems in your body.
Yeah.
Through one
Particularly
of
the
our
heart, I mean,
Yes.
the burden on the heart is just amazing.
Yes. Well, our impact grant through the Community Foundation of West Georgia, which was submitted, was for obesity. We want to develop a year-long program to be able to serve the community and patients, to kind of come alongside and kind of coach them through healthy lifestyle, healthy nutrition, and get them moving in regards to their health.
All right, well, we're going to get moving right now and take our second break to hear from Tanner Health System. You can give us a call at 678-601-TALK, or you'll find us on the News Talk 1330 Facebook page. We'll be back with more about the Rafah Clinic with Dr. Joseph Cox after this word.
At Tanner, we're advancing health throughout West Georgia and East Alabama because we know that exceptional care isn't based on how many patients we serve, but how well we serve them. That's why we're focused on quality, delivering the best possible care for our patients. It's why we're expanding our clinical services and building new facilities to serve our growing community. And it's why we're looking beyond our hospitals and medical practices to develop sustainable wellness and preventive health programs in our region. What makes a hospital great has changed. It's not how many beds we have. It's how well we care for the neighbors who need them. Delivering the right care to every patient, every time, is how Tanner is advancing health with medicine beyond measure. Learn more at tanner.org or find a physician on our medical staff by calling 770-214-CARE.
Good morning. Welcome back to the Community Voice. I'm Steve Graddick. Glad to have you with us. Thank you to those who are watching on Facebook Live. We have Janie Wiley. Great info. Thanks for the wonderful work that you provide, Dr. Cox. And Lisa Bright, referring to her husband, went to the Bowden office years ago, was diagnosed with diabetes, and from very caring personnel to get it under control. And she says we're blessed to have a program such as this. And so some good comments already. A good comment from Leslie McPherson. Anyway, there's so much. Let's talk a little bit because we're going to run out of time, and there are a couple of things I really want to get in. We've had a fundraiser for several years now, I think 2 or 3, called The Sound of Medicines, where all these docs get together who apparently are musicians also. And it's a real cool, interesting, and easy, quote unquote, fundraiser to do. And so you really are looking support from the community, not only in terms of donations and funds, but for volunteers also, correct?
Correct.
Let's get a little closer to the mic.
Eventually, we'll have an upgrade to our website where they'll be able to peel off or download the actual volunteer application. But you can contact our offices and we can send out a volunteer application for you. We do once a month, we do some training so that they are very aware of the community we serve. And it walks through the processes in regards to working at the clinic.
And so you welcome volunteers of that nature that might not be professionals per se in terms of the medical or dental field, but you can always need people to help out.
Correct. Administratively, we have a lot to do on our plate.
Yeah.
And so every bit of help from the community helps us move forward.
One thing about Rapha, we started out the program, you mentioned about the Hebrew word, a kind of a holistic word for healing. This is really a faith-based ministry. Tell us your vision and your understanding of how that is intertwined in the work.
Yeah, some people see us as a healthcare provider that does a little bit of faith. I see us as a mission where we're serving the community through healthcare. We provide prayer ministers in both locations to be able to pray with individuals, to give them a chance for hope and a chance for changes, positive changes through Christ. You know, Luke 10 talks about loving the Lord your God with all your heart and all your soul and all your strength and all your mind, but it also says to love your neighbor as yourself. So I think in the simplest terms, the mission of Rapha and the roots is the fact that we're there to give them a chance for health care, but also to give them a chance for positive change through Christ.
The second greatest commandment.
Yes.
Okay, your website is rafahclinic.org. And we want to invite everybody to come out to the open house for the Temple Clinic. Tell us about when that is. Let's get that date straight and time and everything.
Yeah, December 2nd, Sunday, December 2nd, at 2 o'clock, we'll be having a celebration service and a dedication, first to the Lord and then to the community. And after that, we'll be doing clinic tours up until 5 o'clock. So it's a great day to come out to kind of learn more information about us, to get the information you need to. There's probably someone that you'll see during the course of your week that could use our services, and we want to be able to offer that to the community.
I think because I was able to tour the Temple facility, I think people will be amazed about the complexity, if you will, of providing these services. This is not some small feat. When is you mentioned that you have to you don't take walk-ins, so they have to make an appointment.
Yes, we do financial screenings on Tuesday afternoons from 2 to 4. And we kind of verify that you have no insurance and what your income levels are, and then we walk you through that process. From that meeting, you're usually scheduled for some lab analysis work, and then you're scheduled to see a provider after that. So it's kind of like a 3-step process. We're not an emergency clinic. Mm-hmm. If for some reason there's an accident and you need emergency care, please go to the locations in regards to that. We're basically there for acute care and chronic care management of long-term disease. Mm-hmm. So we serve there. Sometimes we'll see our clients 1 to 4 times a year, just a checkpoint and just providing the necessary wraparound services that they need.
Mm-hmm. Just helping us all stay healthier.
Yes.
And keeping the financial burden down on the healthcare system.
Absolutely. We want to become a faith-based program that are specialists at health and wellness. Mm-hmm. So we're trying to, as we move back into the new facility, we're trying to get the infrastructure in place so that we be able to serve more and more people in regards to healthcare and also provide more hope for the future.
Well, again, as we started, welcome to West Georgia, and I trust your stay here will be long and fruitful, and hopefully over time, pretty much everybody around here will get to know you. And it's not sunny Florida, but it's probably the second best sunny Florida.
It's been the community's been very warm to us, and we're excited about the collaborative spirit in the area, where agencies are working together to serve the neighbors in our communities.
If you want to know more information, simply contact Dr. Joseph Cox. Their website is rafahclinic.org, R-A-P-H-A, clinic.org. And we want to thank you for listening to the Community Voice every morning at this time here on WLBB, brought to you by Tanner Health System. Go out and make it a great week. Hopefully no hurricanes this week. And make it a great day. You're in tune to WLBB Carrollton.